In this section of the video, we are going to look at the brachial plexus, the upper limb girdle, which includes the arm, the forearm, and the hand. We will be looking at the nerves, the muscles, and the joints, and how these three work together to contribute to the movements of the upper limb. So let's start with the brachial plexus. The brachial plexus originates from cervical roots as well as the thoracic root T1. They originate from C5 to T1 from the anterior rami, also called the ventral rami of these spinal nerves. The roots lie in the posterior triangle of the neck behind the sternocleidomastoid. The roots then form the trunks. They lie in the posterior triangle. Then the divisions lie behind the clavicle. And as they fall into the axilla, the cords and then the terminal divisions of these nerves are formed. So let's look at the triangle of the neck in relation to the brachial plexus. So that's a mastoid process, and that is the suprasternal notch with the sternocleidomastoid having two heads, sternal head as we see here and a clavicular head as you see here. So that join to form the sternocleidomastoid muscle this way. So the brachial plexus lie behind the sternocleidomastoid muscle. So that will be C5 to T1 nerve roots joining to form the trunks with the upper trunk lying in the occipital triangle, the middle trunk lying just a touch lower down, and the lower trunk lying in the supraclavicular or the subclavian triangle. These trunks then form the divisions, which they divide into anterior and posterior. These divisions, as they come into the axilla, which I will be demonstrating later on, they will be forming the trunks as well as the nerves. These nerve roots essentially contribute to all the muscles in the upper limb, including the anterior chest wall, the pectoral group, as well as the muscles on the back of the shoulder and the scapula, including the latissimus dorsi. Let's just look at the muscle groups to start with. The shoulder joint or the shoulder is covered by an anterior group of the deltoid, the lateral fibers of deltoid, as well as the posterior fibers of deltoid. These three groups of the deltoid muscle have different function, which we will be going through as we look at the movements of the shoulder joint. The next muscle group we will be looking at will be the flexor compartment of the arm, which includes the biceps, coracobrachialis, and brachialis. On the posterior surface of the arm, we have the triceps, which has got the long head, lateral head, and the medial head. Then we look at the forearm muscles. That can be divided into a flexor compartment on this side and then extensor compartment on that side. Let's look at the flexor compartment of forearm. The flexor compartment muscles help in flexion of the wrist, and the long flexors contribute to the flexion of all the digits, including the thumb. On the extensor side, the extensor compartment muscles help in extension of the wrist, extension of the fingers, extension of the thumb, including abduction of the thumb. If you look at the hand, it's broadly divided into a hypothenar muscle group, a thenar muscle group, the lumbricals, the interossei muscles, which are divided into a palmar interossei on the palmar surface and a dorsal interossei on the dorsal surface. These muscles together help in abduction of the fingers, that is spreading of the fingers, adduction of the fingers, which is bringing the fingers together, which includes scissoring of the fingers, pushing the little finger to the side, bringing the thumb towards the index finger, which is adduction of the thumb, lifting the thumb towards the ceiling, which is abduction of the thumb, opposition of the thumb, which touching the tips of the fingers with the thumb, and finally flexion of the metacarpophalangeal joints and extension of the interphalangeal joints in this position, which is the action of lumbricals. So that is flexion of the metacarpophalangeal joints and extension of the interphalangeal joints. So these are the main muscle groups and muscle actions. To do this, the brachial plexus has to contribute in its innervation.